In depth this Friday on the new Affordable Care Act. The deadline to sign up for coverage is fast approaching. You need to have some sort of health care plan by March the 31st, or you're going to get fined. BN9's Melissa Eichmann sat down with an expert to find out the 5 things you should know before you sign up.
Time now for today's In Depth. Our guest today, nationally known author, speaker, and advocate for worksite wellness, Dr. Carmela Sebastian. Welcome.
Thank you so much.
Thanks so much for joining us. Now, we're going to be talking about the Affordable Care Act and some steps that you say people need to know when making a decision.
Right.
But you promised to keep the politicking out of it, right?
Yeah, as much as possible, as much as possible.
Okay, tell us about your 5 steps. What are they, and why are those 5 steps so important? What's number 1?
Okay, well, number 1 is that we really want everyone to know about pre-existing conditions and the fact that that no longer carries any weight. And you shouldn't be afraid, even if you have a health issue, to go ahead and try to get health insurance. Previously, in the last 10 years, if you go back, health insurers would put a clause in the contract that basically said that if you had a condition prior to getting the contract and something happened related to that health condition, they can deny coverage for it. And it was considered pre-existing to the contract. So, for example, if you had angina in January, you got your policy in February, and you had a full-blown heart attack in March, then perhaps they would be able to deny coverage. They would look back either 6 months or even sometimes a year. So the first thing is, don't be worried. If you have health issues, you can still get coverage.
Okay, so pre-existing conditions, number 1.
Right.
What's number 2?
Okay, number 2 is it's always better for people to have some coverage. Okay. And why is that important? Well, first of all, you know, if you have some coverage, you're more apt to have a primary care physician. If you have a primary care physician, then you're more apt to get preventive care. So people who have coverage generally can keep themselves healthier, and in the long run, it will cost less money.
Kind of a snowball effect. What do you see are the biggest concerns, the biggest questions with that step, number 2?
Well, I think that you know, we have people who don't have health coverage, and they show up in the emergency room. Nobody knows their history, and you have to start from point A. You have to do all the testing. It's very expensive. Instead of just being able to have the emergency room doc call your physician and say, okay, what was their blood count when you saw them last week? So it becomes very expensive, and then when they leave the emergency room, there's no follow-up care.
Okay. All right, on to number 3, Dr. Carm.
Yes. So you really need to know your options. And I put this under, you know, healthcare is becoming more of a commodity. You have to be an informed consumer.
Right.
You really do have to know, and there's no excuse for it. We can't leave it up to the physicians. They're too busy, and they're not the most important person when it comes to your health. You are.
Exactly.
So you have to know your options. First of all, if you are employed and your company offers insurance, your best bet will probably be to get coverage through the company, because the company has clout to go out and negotiate with the insurers. You're probably going to get your best rate that way.
Okay.
Now, let's say that you work for a company and they are not providing coverage, which is happening to people, right? Well, you need to have coverage. So what you can do is you can go to healthcare.gov, which, as I understand it, is much better than it was several months ago.
It's up and running
right,
now.
It's up and running. And then if you don't want to go that route, if your state is taking part in the exchanges, you could go to your state website and participate. And if all those things fail, then there's Medicaid. Look into Medicaid, because a lot of states have expanded coverage for Medicaid.
Okay. All right, on to number 4 now.
Okay, number 4. This is so important. I hate to see people leave money on the table. Preventive care is free. So there are over 25 different services that are absolutely no copay if you have insurance, no co-insurance. So our colonoscopies, which are so important for us to get, our mammograms, childhood immunizations, the list is very long. You could find it on the web. And it's so important to know this, because what happened to me was I went for a colonoscopy in December, and I thought, well, wait a minute, you know, it was screening, it should be free. But what happens? A month later, I get a bill for $500. And I asked myself, why? And then I called up and I said, why did I get this bill? It should be 100% free. And they said, sorry, we used the wrong code. Know what you are going, get those preventive services and don't pay a dime.
Okay, don't pay a dime. On to number 5.
Okay, women rule. Yay, finally, finally. So as part of the Affordable Care Act, maternity and newborn care are now considered part of the benefits and that they have to be provided. Where before, you know, you could leave those out. A lot of people don't know that, but you could leave them out. So right now, don't be afraid. If you're thinking about having a child or if, you know, you're pregnant already, don't worry about that. Secondly, we used to do something in insurance called gender rating. Women, and this will not come as any shock to you, go to the doctor more than men, right? We do not stay at home and moan and I'm sorry. No. So we go to the doctor and we get care, which means that a lot of times, even though it's preventive care, we cost a little bit more than a man the same age. Plus we have babies and that costs a little bit more. Now insurers are not allowed to gender rate. So we can go and it's not going to cost our companies any more than it would otherwise.
Okay, those are the 5 steps. Now talk about, you've been researching this, the changes in the benefits, the changes in everything. What is your take on all of the confusion, the controversy surrounding the Affordable Care Act?
Well, you know, there is an awful lot. I mean, I can't wrap my head around it, and I've been doing this for over 20 years. First as a practicing physician and then getting into the administrative side. And I don't, believe me, I came this close to paying that $500 colonoscopy bill. So I'm just like everyone else. But what I want to say is you have to educate yourself. There are more than 10,000 pages to this bill. When the law comes out and starts coming out in dribs and drabs, it's going to go in front of committees and they're going to change pieces of it. So just keep up with it.
Okay, and for those people who want to review your 5 steps, do you have a website or a Facebook page people can visit?
It's www.drcarm.com.
Okay, and of course, open enrollment ends on March 31st.
Yes.
Dr. Carm, thanks so much for joining us.
Thank you.